Since 2023, I've had a lot of right lower abdominal pain. I went in and had an ultrasound done 2 years ago, and they found out I had a right ovarian cyst, which measured 3.5 centimeters in diameter. Now, I wasn't real concerned about that because that is not a very large ovarian cyst, and I was told I would only need surgery if the ovarian cyst grew to be more than 5 centimeters. So I've been holding off for 2 years to really find out if it's developed. I haven't had a lot of pain, so I've been pretty confident it's stayed the same size. However, recently I've had a dramatic increase in my pelvic pain. I've been so sick. I sometimes am just doubled over and I just think I'm going to die. It's just overwhelming, all the symptoms I'm having. A few weeks ago, I went in to see my primary care provider to ask if I could have an abdominal ultrasound done. The medical provider agreed and ordered me an abdominal ultrasound. About a month ago, I had the abdominal ultrasound done, and I was so happy I made it through because if you know anything about the abdominal ultrasound, you have to drink lots and lots of water, and you have to have a very full bladder, and I wasn't sure I was going to make it because I had to go to the bathroom so badly. But I did, and I was so proud of myself. Now, usually the results are posted online, and they're usually posted very quickly. So I've just been like, come on, every day, just checking. And they have not been uploaded. And I've become very frustrated. I thought, well, maybe I should contact my medical provider because she probably does have the results. But I don't want to bother her because if I do have an ovarian cyst, there's nothing she can do. I just need to go and find a surgeon and have the ovarian cyst removed if it's necessary. So, not wanting to bother my primary care provider, I've just been checking every single day. And finally, after 1 month, the results have been uploaded to my patient chart. So now I will read you what they found. So it says they found a right ovarian cyst, which measured 6.2 centimeters in diameter. Now, I was a little concerned about this because 6.2 centimeters is a little bit larger than 3.5 centimeters. An ovarian cyst, which is 3.5 centimeters in diameter, does not require surgery. An ovarian cyst, which is 5 centimeters, will start to necessitate the need for surgery. And as an ovarian cyst increases to around 7 centimeters, once it reaches 7 centimeters, most doctors agree that it definitely needs to come out. So my ovarian cyst right now is at 6.2 centimeters. What does that mean? Well, it's bigger than 5 centimeters, so we're definitely on the surgery spectrum, but not quite as large as 7 centimeters, which is kind of like, that's really the ultimate deadline where you need to start seeing a surgeon and get the ovarian cyst removed. While it is not quite at the emergency, urgent, I need to get the cyst removed, it is larger than 5 centimeters and it is causing a lot of pain and discomfort. So I think my next step is to find a surgeon to do this. Now, if you remember, if you've been part of my YouTube channel back in 2022, or if you just watched old videos, which thank you so much for doing that. Back in 2022, I had a massive ovarian cyst, which needed to be removed. It was 14 centimeters in diameter. And you might think, well, why don't you just go use that other surgeon that you saw 3 years ago? Well, I will say he was a fantastic surgeon, really phenomenal skill sets. But I didn't care a lot for that doctor. With that said, I have started researching other surgeons to do the surgery, and unfortunately, there are not a lot of surgeons to choose from. There is a surgeon that is 6 hours away, but that surgeon is at a medical facility I have not had good experiences with. They have mishandled my medical case in the past, and I just would prefer not to be hospitalized at that hospital. Just, I've not had good experiences. And there are a couple other doctors that are at a hospital that is 10 hours away. A little far away, but there are several doctors at that hospital. And I'm thinking maybe I should reach out to one of them and see if they'd be willing to take on my medical case. Because I have a tracheostomy tube and a ventilator, things get very tricky very quickly because people say, oh, you're on life support. oh, I don't want to be your doctor. They get freaked out about my medical equipment, which I understand. I mean, I understand if they don't want to take me as a patient, but I'm hoping maybe one of these doctors will, and maybe I can get surgery for this ovarian cyst to be removed. Maybe, possibly, hopefully, I don't know. There is a lot to consider. There's just a lot of things happening right now, just with my life, with my family's life, that to travel 10 hours to get this surgery done is going to require a lot of coordination on all of our parts. So this is something a little bit farther down the line. And because this is not something that urgently needs to be done right away, we do have that time and we do have that luxury for the moment. So that is my ovarian cyst update. Unfortunately, it has grown. It's grown by 2.7 centimeters. The ovarian cyst now is 6.2 centimeters. It's getting to be a little bit large and it's going to need to be dealt with, which I guess I'm happy about because I really want the pain gone because it's been bothering me since 2023. It's been bothering me for 2 years. I'd love to get rid of this pain. But at the same time, there is a good possibility once we get rid of this cyst, everything could just come back again. So if I could delay the surgery a little bit longer, great, because it would just delay me the next time needing another surgery. But who knows, maybe God will be very merciful and gracious, and after this surgery, just completely get rid of all my ovarian cysts, and I'd be so, so overwhelmed with joy if that actually happens. If I never had to have another ovarian cyst removed or have another ovarian cyst which ruptures or causes complications, I would be overwhelmed with joy. So thank you so much for joining me. Please remember to like and subscribe down below. Please also remember to comment and share. It really helps my YouTube channel. I hope you have a great day and a wonderful week. Bye-bye.